How do you balance patient care with admin, marketing, and business decisions that come alongside running a private medical practice?
I think it always is going to be a challenge, particularly in the early phases of building a practice. Fundamentally, the patient is in the middle of it. So we have to work out how we can offer a good service that makes a seamless patient journey. For me, I have a very busy NHS practice. I work in a tertiary center and the country's biggest young adult hip preservation center. So that keeps us very busy because you have referrals from all over the country. And trying to balance the amount of admin load with that, with the private practice, of course, it's a juggling act. I think on the side of that, I have an academic role as an associate professor at UCL and Imperial. So there's also that other master to serve in terms of making sure that we are delivering in innovation and translating those findings. From a business point of view, I think that the key is having a good team of people. I think fundamentally that starts a team of people at home, having a good family that's supportive. And aside from that, the business managers, the medical secretaries, and so on. I'm fortunate. I'm mainly based my private practice at Cleveland Clinic, and that is a very big institution with a fantastic infrastructure that in a way takes care of a lot of that the heat off me. So I found it relatively seamless, but I do understand that there are challenges in how to deliver patient care perfectly well, as we would do in the NHS and the private sector in a busy life.
How did you decide as a medical consultant which hospitals or locations to practice your private work from?
Partly it's about geography, partly it's about the people there. Partly it's about the services that hospital could provide for your patients that you can integrate into. So when I was joining private practice, I had the choice of a few practices around London, and I'm mainly based in Surrey. My family home's in Surrey, so I wanted something geographically close as well. So I chose Cleveland Clinic fundamentally because it is a big institution that has a level 1 ITU that takes care of the sickest people in town and from across the world. It has a fantastic hip surgery department, and I'm a hip surgeon. So I have colleagues that I can work with for dual consultant cases, a regular MDT that exhaustively goes through images and decisions. So we're making the right choices for patients, an abundance of space as well. So Cleveland Clinic is based mainly in Victoria, but they also have satellite clinics. One's in Moorgate and one's in Marylebone. My NHS practice is at UCL, which is in Euston, King's Cross area. So for me, it was very natural to choose a place that's halfway between the both. So Marylebone's a quick line bike away, and Victoria's a few stops away. That way, is able to manage. Now, Cleveland Clinic has a history of taking patients on that are complex as well. So I was assured that I had the expertise bringing in patients that may not be straightforward. And that was a big reassurance for me. And then finally, I think I worked with lots of consultants who were already at Cleveland. So I had that relationship with them. When I actually arrived at Cleveland, I was offered a few places to work, and Victoria, Moorgate, Farringdon, and what have you. So that flexibility made me feel very welcome to the unit. And finally, it's a big place. There's lots of operating theatres. There's, like everywhere, there's never enough space, but they've been very accommodating with the kind of kit that I want. I'm a young adult hip surgeon, so I do everything from hip arthroscopies to periacetabular osteotomies to anterior approach hips to hip revisions to hip resurfacing, and nothing really threw them off. They were very comfortable with accommodating my expertise despite the fact it's new. And one of the reasons they were welcoming of me is that we're growing that service there.
What systems or tools do you use to manage the operations for your private medical practice efficiently?
Well, at Cleveland, the main electronic health record system is Epic. And Epic is, a globally used system. Is very, very popular in America. And that's why, of course, it's brought over to Cleveland in London. I use it at UCL as well, so it's very, very natural. And I think Epic is the most powerful tool I can have because it manages my calendar, it manages my operating list, and it manages my imaging as well, all in one place. So I found that very natural to use. Beyond that, I found that Epic has a wonderful mobile app as well called Haiku. And with that, I'll be able to review things on the go. I can see MRI scans, CT scans, everything I want on the run, order scans. So that makes it very streamlined in how I have that relationship with my team in theatres, my team in the secretarial office, and with the patients on the ward. I can act very quickly and respond quickly. In the clinic room, I think that the last, let's say, 1 year has been pretty transformative for me. So as a young adult hip surgeon, I'd say that the history, the examination, the review of the imaging is probably more intense than my classical patient with hip arthritis who's a bit older. And therefore, a lot of the time is spent listening to the patient. And of course, we all have relatively tight slots for seeing patients and understanding and making solutions and documenting. And the one game changer for me certainly has been ambient AI. I think AI has been touted for probably 5 years as going to be game changing, but the one pretty much simple thing I use is either Tortoise or Heidi or something like that. So by the end of the clinic, I've got my letter and I'm not focusing on the computer. I'm listening to the patient. So things I've forgotten are already there. I can make a management plan pretty quickly. I think beyond that, I think in the operating room, again, because I do a lot of osteotomy work and arthroscopy work that requires a lot of 3D planning, a lot of my patients will have CT scans. They go into 3D planning that I'll be looking at offline with engineers and then translating that plan into the operating room. And right now, it's just a 3D screen in the corner of the room that I'll be going through and actively taking X-rays or CT scans and understanding I've got things right. But in the next couple of years, and one of the things we're working on in my research lab is how to bring that to a more navigation assisting technology where we can have headsets or glasses and so on. So we can do AI assisted surgery for some of the stuff that I do. So not only are we planning well, but we're also executing perfectly as well. So I think that things are in flux right now, but the game changer really, as I say, is a bit of ambient AI and having accessibility to the electronic health record wherever I go.
What have you learned about how patients make decisions about choosing their private medical consultant before making the initial booking?
Let's start again that bit. Okay. I think London has a plethora of really talented hip surgeons. So for a patient to choose is a difficult one. I mean, fundamentally, it comes down to the age-old, ChatGPT search or Google search, understanding who that surgeon is. And then the second part of it is the team. And the third part of it is accessibility, right? So in terms of the surgeon itself, I think people come to me personally. I find that people tell me they've come to me is because I'm a comprehensive hip surgeon. So often they've seen other surgeons before who do a certain procedure very, very well, like let's say a hip replacement, but they may not do everything else. And therefore, there's no scalpel bias in my practice. And that's what I call it anyway, where I'm deciding to do an operation or offer a service or think of a management plan because that's what I do. So I think surgeons and patients have a good relationship when all options are available in that consultation. So that's why patients come to me. The second part, as I mentioned, is about the team. Whether I'm in Cleveland or in Surrey, I think surrounding yourself with good radiologists, good surgical assistants, good physiotherapists, good rehab teams, and good facilities that help the patient prehab and rehab is super important for patients. Patients are really savvy right now. They realize that having a consultation with a surgeon or having an operation is just a tiny snapshot of their journey. And when they realize that they need more than just who they're seeing in that clinical consultation room. A lot of my patients are younger, in their 20s and 30s, for example. Some of this is impacting their life. Some of this is impacting their mental health, their schooling, their education. So in that way, I've got a good team of people around me that are not just physiotherapists or sports and exercise doctors, but also sports psychologists too. So I think that's one of the reasons people might come to see people who are more plugged into the MDT. And finally, I think the accessibility is really, really important. So as I mentioned, I operate at UCL and patients see me, obviously routinely there. But privately, I run 2 clinics and one's in the daytime, one's in the evening. I operate regularly and sometimes ad hoc as well. And patients really want that flexibility. It is more of a concierge service. And I think healthcare is a very personalized thing these days because it is a competitive market. So you can offer, the expertise, the teamwork, the accessibility. I think patients are pretty trusting of that, and then recognize your reputation or your fellowships and all of that. And then it's all about trust. So if you can engage the patient, make them trust you, establish your expertise, demonstrate your reviews as well and your competence that way, then there's a good relationship.
Agreed. And then obviously a lot of people follow me because they want help with growing their practice and marketing their practice. I wanted to ask, what's your approach to marketing as a medical consultant? When do you see as essential or when do you see as optional?
I think in the modern, today's world, I don't think it is optional. I think, putting yourself out there is, the only way to build a practice. One could be the most skillful surgeon with the most wonderful team, but you could work in a silo where patients don't have access to that because they don't know about you, or GPs or sports doctors and physios don't know about your expertise. And of course, we're here to make a living, but also number one is we are trying to deliver a good service. So if you think you're able to offer a special service, then the only way to tell people about that is to talk about it, to market yourself. That would typically be in a number of ways. So one would obviously speak to lots of colleagues and explain to them the services you have available. I think social media is a very powerful tool that, I've been a reluctant observer for a long time, and then now engaging, which is obviously a new task and a new skill itself. And the third part is actually receiving that feedback from patients. Again, that's a very informal thing. If you're an NHS doctor, patients come and say, I'm really happy with my service, and then, your outcome has been good and so on, and then you might discharge them. But that's never really gone beyond the patient letter that you feed back to the GP and the patient, but actually engaging that feedback to online reviews, and engagement to other patients in their own patient circles and social circles, that's a big part of marketing. So to your question, is it optional or is it mandatory? It's a choice, right? But I think in this era, it is fundamental to how one grows a private practice.
How do you think artificial intelligence will change the doctor-patient relationship over the next 5 to 10 years?
That's a tough one. I think right now, even though we've been hearing the term AI for a few years now, it's not really made that massive impact to the coalface as we'd hope it would, but it's going to. I mentioned earlier on that I use ambient AI routinely. So already that's impacting patient care because I'm able to focus on the patient rather than my screen or my thoughts about, documenting and writing down things I might forget. So immediately I feel I'm more engaged with patients. Moving forward, it's about access, right? So healthcare is growing because patients are getting older. They're more knowledgeable about their problems and they want cures because I think we're all quite high demand of ourselves right now. We want to engage with the world and get on with life, despite our bodies sometimes holding us back. So we are accessing healthcare a lot more informally online or actually reaching out to our GPs and our specialists and so on. But of course, there is a bottleneck because, ultimately we can't speak to everyone in the amount of time that they want. So I think if I look at a few startups which have now become unicorns on the West Coast, they are mainly engaged in how to create AIs that have that patient-doctor relationship, or at least a healthcare professional relationship that triages a lot of information, gives information that is safe, but also very useful before it needs a real person, for example. So I think that way we're going to have better access to good quality healthcare that's not just a Google, because there's always a danger of the information you receive. The third part of it, I think, is going to be in the hospital itself. So right now, again, hospitals are driven towards efficiency because we need to deliver a service, keep costs down, keep patient flow up. And I think AI is streamlining a lot of the processes in hospital. So for example, if it's documentation, a lot of it's automated right now. In radiology, some element of it right now is being automatically reported and then checked by a radiologist, for example, and therefore it'll be screened for the correctness of it, the factual accuracy of it. And then finally, it's going to be a little bit more of the processes behind the scenes entirely. So if you look at pharmacies, particularly in America right now, a lot of that is AI driven in terms of how medication is bundled, how medication is checked that it's safe and so on. And actually the delivery of the medication as well is also technologically assisted. So right now, I think in the UK, we're at a nascent phase. But if we keep looking at how we tend to reflect and follow the rest of the world because we slightly move slower and more cautiously, I think AI is going to transform the patient experience by making it, I think, friction-free, or at least reducing the friction between the patient and the healthcare system and improving access.
Yeah. No, agreed. I think that a lot of things will happen. I think some of those things are pretty much spot on. So yeah, like obviously just AI and tech in general, like with the adoption into that into medicine, I'm curious to know, like, do you feel like some of that personal human care element will diminish, and how do you maintain like that human element with, adding a bunch of technology throughout the patient journey?
I think we're already seeing that, not in the medical world, but just in how we interact with appliances around our house and our phones and our computers, right? For at least 5 years, we've been chatting away to the box in the corner, whether it's an Alexa or a Siri or a Google or what have you. So they are becoming assistants that we're comfortable to talk in a natural way to. And that's just going to translate to healthcare as well. The difference is, of course, that healthcare requires a lot more trust than asking what the weather's like tomorrow. So it's going to be a case of patients knowing that the information they're receiving from our AIs is as trustworthy as they would expect from a qualified clinician with lots of training. Beyond that, I think it's about segregating the roles. I think no one, you say never, but you should never say never, but no one will ever replace a doctor-patient relationship because it goes beyond just fact and expertise. It goes into the psychosocial element of what constitutes a healthcare. So we need to understand where we segregate those two and how AIs can augment our factual expertise and then flip over into that human element, which is actually decision-making that weighs in that holistic aspect of how pain or dysfunction or stiffness or whatever orthopedic problem that patient's got actually balances with their life. So going back again to your question, Abe, I think that we are already very comfortable with AI, but we just need to be sure of when it's safe and when we need to make sure that it is personal.
What mindset, perception, or paradigm shift has helped you the most in growing your private medical practice?
I have been juggling clinical medicine, surgical training, and academia since I qualified, just through lots of research and a PhD, and then carrying on now, trying to do complex stuff alongside educating and teaching and researching and so on. So the number one thing that private practice adds is a stretch on your existing time. The mindset that one has is always a growth mindset, but also a mindset that we have to balance what's important to us. So there are only so many hours in the day. There are only so many kilojoules I can, burn. So I've just had to work out how to reallocate my energy. So I'm still a good father, I'm still a good husband, but also I'm delivering good patient care and delivering things for university and for education. So number one is a growth mindset, I think, with balance. The second part of it is really about resilience. I think that if you're an interventionalist, whether it's a radiologist, a cardiologist, a surgeon, or what have you, things do sometimes go wrong. You're trying to do hard stuff. So certainly as a consultant over the last few years, I've realized that resilience is probably the number one biggest differentiator between success and not failure, but shrinking away from growth, from challenge, from dealing with patients, from understanding how we can grow and learn from our mistakes and so on, because things don't always go right. So resilience is something I've developed over my time as a consultant, because I feel the pressure of the high stakes things that we do and the impact it has on patients. I think the last thing I probably would say about growing a private practice and the mindset shift, it's about openness and collaboration. As I mentioned before, a private physician, a private clinician is trying to make a living, but they're trying to make a living by delivering excellence. And we have, I think, maybe as a surgeon, I don't know, but certainly been thinking of ourselves as playing singles tennis. We're on our own. But actually, as a private practice manager, I realize it's much more about the team and growing together, and also growing that team and growing that network. So I don't know if I've always been an open person in terms of shaking hands at parties and saying hi to people I don't know, but certainly I've had to engage that part of me much more proactively, putting myself in situations where I may not be that comfortable to speak to people about myself. Maybe that's just a trait, or maybe it's a British trait, but certainly we need to be out there and saying, this is what I do, this is what I'm good at. This is why I'm talking to you, for example. I'm not particularly comfortable right now. So those three things are the mindset shifts that I've evolved through over the last, say, 10 years on some of them to get to where I am. And I'm not very far. There's a long way to go. And so keep growing.